I have a master's degree in kinesiology. I've been doing bodywork, specifically structural integration, ART, active release therapies, for over 20 years. Kinesiology is pretty much knowing how the muscles are supposed to move in the body and how it's supposed to work.
From seeing what you've done and what I used to go to a chiropractor, I'd say it's like a lot more sophisticated because you need to know a lot more than just...
You have to know bones, tendons, ligaments, all of it.
Chiropractor, you don't need a master's degree in that. You mentioned literally our first session ever that Clover might have a hEDS. Like, what made you...
From the way that she was describing everything, how it moves. I've had patients in the past that I've dealt with that have had hEDS, and I saw her lay down and I asked her to pick up her leg once, hyperextended, without even really doing anything.
Well, I mean, even right now her ankles are hyperextended. Yeah, I'll get a pillow. Give me the pillow for
Yeah.
Right, because that's not supposed to be bent like that, right?
Nope, it's not.
Yeah, I notice if we don't do this, it really makes your ankles all messed up and your feet get like super hot.
Generally speaking, people don't swell at the ankles and feet unless they've been on their feet for hours and hours and hours. You have that happen when you have your feet in a particular position, right?
Or just, if she's like cooking in the kitchen for like 45 minutes, after that, I usually will just work on Clover's feet for like 20 minutes just because they actually get red hot.
Honestly, POTS would definitely track with that, and its comorbidity with hEDS is very common.
Yeah. Lymphedema, fibromyalgia.
Yep.
They always end up misdiagnosing all those, right?
All of them have so many similar traits that it's difficult to make a diagnosis without a rheumatologist.
Subluxation. That's the big one that Clover deals with because
Indeed. Subluxation is not common in normal people. However, with people with hEDS, it's very common. Things will move to the point of hyperextension and beyond. Some people can actually have complete dislocations, not just subluxations. Yeah.
It's always their right shoulder. They get a surgery on their right shoulder first because they shoulder will be subluxed. They tear their bursa.
Yep.
But basically what a subluxation is, it's when a ligament or a tendon or something or a muscle gets slid into the wrong place.
Yep, pretty much.
And that happens with people with hEDS because they don't have enough collagen, right? So, but people don't realize that means her stomach too. It's really bad with
all connective tissue. Literally all connective tissue. And most people don't understand that with any hEDS diagnosis, it's literally can be everything.
Yeah, your blood vessels.
Move, including your teeth.
Because your blood circulation isn't getting to your teeth enough. And periodontal surgery and their dominant hand shoulder surgery. Those were the two that everyone gets in their mid to late 20s.
Lots of TMJ problems as well. So problems with chewing and problems with lockjaw are all very common.
Clover got an AMG right before we moved to LA. So that's when we found out your subscap wasn't firing. I remember when you looked at Clover, you were like, honey, your subscap isn't firing. You're like, you're right, your subscap isn't working at all.
It's that's why the scapula is winged, is because the muscle is not firing and holding in where it should be.
And that shows the power of kinesiologists and that, because you didn't have to do an EMG to know. You literally said it right off the bat before we even brought it up to you. Scapula was raised, right?
Yeah, it was winged is what it's called.
It's even higher right now, still a little bit.
Oh, it's definitely nothing close to where it was.
Oh my God, yeah. It used to be when we first came in.
It looked like she had wings.
This is the reality of hEDS is people with it, they got to go get body work at least once a week.
It's one thing pulls on another, pulls on another, pulls on another to try and pull the weight of the muscle that's not firing.
So what was the compensation pattern happening with Clover as a result of the subscap not firing?
So subscap wasn't firing, so it was actually putting more stress and strain on the levator scapularis, which elevates the scapula. So anytime she moved her arms this way, that kept on making the rib move. You can actually see the anterior tilt in the pelvis because of lack of muscle firing in the erector muscles, and the multifidus is working overtime, so the back is never relaxed because all of these muscles, the rhomboids, aren't firing the way they should. It's like a domino effect.
And I'm super grateful for you and everything we've learned since coming to you. The most profound thing I think you taught us was the fact that muscles are activated or they're not.
Indeed. There are lots of different things you can do to activate the muscles, different exercises and things of that nature, but a lot of muscles are a lot more active than others. You have support muscles and then you have smaller muscles that don't actually do the support, they do finer movement. For example, the piriformis is deep in the hip, but you're going to be working more of your glutes than you're going to be your piriformis. However, if something happens to your piriformis, all the glutes have less function. With that sort of compensation going on, it shuts down the entire system around it, almost like a computer.
And once that muscle gets activated, you can't shut it off.
You can have them where they're not firing at all, or you can have them where they're too active and they're doing too much. So the other muscles will get weaker.
If anyone's watching this and you're not on the table, it feels horrifying. Like, it's literally like body horror. You're going in and releasing. I literally will hear my muscles snap, feel you working on like a specific muscle, and it like springs because it releases, and then everything lays flat. Just like Clover's like scapula is now it's laying flat.
Yep.
And it was sticking up before. But that's like the essence of what you're doing, is releasing muscles that are too active or stuck on essentially. And
pretty much taking any compensation patterns that it's created and working backwards, making everything iron out.
it is physical therapy. It's about giving it a chance to start resetting and getting structure back. Overall, like, her scapula is nowhere near what it used to be. And Clover has mentioned it too, like when we're coming every week, the difference, quality of life is huge.
A lot of people have hEDS and it's difficult to get a diagnosis, and that's the big thing that's going on, is the lack of additional criteria to be able to diagnose, the lack of funding, and the lack of knowledge. hEDS, like EDS of any kind, is an invisible illness. People can't look at you and tell. There are lots of things that make it more obvious, like if you actually have a full dislocation or subluxation.
It's funny because it's not invisible to you though,
no,
a medical professional.
But that's me.
Right.
I can look at someone and be like, oh my God.
Right.
Most people don't see it. Most people don't see it. So it's like, well, there's nothing wrong with you. And it's like, well, you really don't know.
If they can somehow afford it, like being able to go get body work done once a week can really make a big difference, you know?
Indeed.
It's one of the few things you can do, really, because there's no cure, right? So it's like getting body work done, getting custom fitted compression garments.
Yes.
Regular physical therapy on top of that.
Being active. Making sure that you do not let yourself get sedentary.
Having a wheelchair allows us to do more things, especially like to go to the DMV. Instead of that going there and then wrecking Clover for like 2 or 3 days, like we can literally take the wheelchair. Clover gets to walk a little bit.
Mobility aids are really big with hEDS, and most people don't understand because it's not one of the common things that you would actually need a wheelchair for. And a lot of insurance and a lot of doctors don't really consider it disability, which is terrible.
It's crazy because it's like a terminal illness based.
Mobility aids are crucial to people with hEDS.
That's a good point too. It's called a mobility aid.
Yes.
Without it, you're not getting as mobile.
Exactly. Common things that you wouldn't think would be difficult can be really difficult for a person with hEDS.
Yeah.
Taking a shower, standing for long periods of time, taking and doing stuff with your hair or makeup, lifting your arms above your waist can be difficult.
I didn't understand what Clover was going through. You know what I mean? Because like when we moved in here, Clover was like, the cabinets don't work for me. You know what I mean? Clover was like, this is a problem. Okay, our bathroom, Clover was like, this bathroom is really bad for me because like the mirror is far away across the sink. And I didn't realize like how hard it was for her to do her makeup and stuff, you know, to reach and to stand there, you know, for a long time. She needed somewhere to sit, basically.
Yeah.
The biggest one I'm most guilty of not understanding was the eating.
Oh my gosh. Very much so.
Right, when you eat with EDS, like you get extreme pain, and a lot of times you have to sit there for like an hour. Because Clover would always do this. Clover would be like, Clover would not eat before we were done working on something. Like we'd be getting ready to go do a project, go film somewhere, go do whatever. And Clover would be like, you don't understand, I can't eat. I'd be like, man, you gotta eat something because then you're gonna get nauseous. We're gonna be out an hour later and then you're gonna feel sick. The reality is if she would just eat before we left, then she'd be sick for like an hour and then we missed the thing.
Yeah.
And then it's hard for her to work after it. Even yesterday, we were gonna go grocery shopping and Clover was like, I need to eat something. We went to a McDonald's before we ate and then Clover was like, I feel so sick. Like I literally like am just dying because in so much pain because your intestines are all tangled up. Got a really good example of how like waiting till we were done grocery shops to eat. It's like ironically, for not eating when drinking coffee is actually better. But for me back in the day, it would seem crazy to me.
You didn't understand.
I would be like, look, if you don't eat nothing and drink coffee, of course you're gonna feel nauseous. I appreciate everything that you've taught us and taught me. It's helped me understand what Clover's going through better.
Of course.